Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A multigravida client is admitted to the hospital with a diagnosis of ectopic pregnancy. The nurse anticipates that, because the client's fallopian tube has not yet ruptured, which of the following may be prescribed? 1. Progestin contraceptives. 2. Medroxyprogesterone. 3. Methotrexate. 4. Diphyline. The correct answer is 3. Because the fallopian tube has not yet ruptured, methotrexate may be given, followed by leucovorin. This chemotherapeutic agent attacks the fast-growing zygote and trophoblast cells. RU-486 is also effective. A hysterosalpingogram is usually performed after chemotherapy to determine whether the tube is still patent. Progestin-only contraceptives and medroxyprogesterone are ineffective in clearing the fallopian tube. Diphyline is a bronchodilator and is not used. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary through an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. The nurse is caring for a client with a suspected diagnosis of hypercalcemia, which sign/symptom is an indication of this electrolyte imbalance. 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. A primigravida client with class 2 heart disease who is visiting the clinic at 8 weeks gestation tells the nurse that she has been maintaining a low-sodium, 1,800 calories diet. Which of the following instructions should the nurse give the client? 1. Avoid folic acid supplements to prevent megaloblastic anemia. 2. Severely restrict sodium intake throughout the pregnancy. 3. Take iron supplements with milk to enhance absorption. 4. Increase caloric intake to 2,200 calories daily to promote fetal growth. The correct answer is 4. The client can continue a low-sodium diet but should increase the caloric intake to 2,200 calories daily to provide adequate nutrients to support fetal growth and development. Folic acid supplements, a standard component of care, are used to prevent folic acid deficiency, which is associated with megaloblastic anemia during pregnancy. Severe restriction of sodium intake is not recommended because sodium is necessary to maintain fluid volume. Iron supplements should be taken with acidic foods and fluids for maximum absorption. Milk decreases the absorption of iron. When developing the collaborative plan of care with the healthcare provider for a multigravida client at 10 weeks gestation with a history of cardiac disease who is being treated with digitalis therapy before this pregnancy, the nurse should instruct the client about which of the following regarding the client's drug therapy regimen. 1. Need for an increased dosage. 2. Continuation of the same dosage. 3. Switching to a different medication. 4. Addition of a diuretic to the regimen. The correct answer is 2. Unless the client has cardiac decompensation during the pregnancy, she will most likely be able to continue taking the same dose of medication. The client may be prescribed prophylactic antibiotics, particularly if she has had rheumatic fever. The medication will be switched only if digitalis toxicity occurs. A diuretic is added only if congestive heart failure is not controlled by sodium and activity restrictions. After instruction of a prima gravida client at 8 weeks gestation diagnosed with class 1 heart disease about self-care during pregnancy, which of the following client statements would indicate the need for additional teaching? 1. I should avoid being near people who have a cold. 2. I may be given antibiotics during my pregnancy. 3. I should reduce my intake of protein in my diet. 4. I should limit my salt intake at meals. The correct answer is 3. The client needs a diet that is adequate in protein and calories to prevent anemia, which can place additional strain on the cardiac system, further compromising the client's cardiac status. The client should avoid contact with people who have infections because of the increased risk for developing endocarditis. The client may need antibiotics during the pregnancy to prevent endocarditis. Limiting sodium intake can help to prevent excessive expansion of blood volume and decrease cardiac workload. A prima gravida client with diabetes at 39 weeks gestation is seen in the high-risk clinic. The primary health care provider estimates that the fetus weighs at least 4,500 grams. The client asks, what causes the baby to be so large? The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. After teaching a diabetic prima gravida about symptoms of hyperglycemia and hypoglycemia, the nurse determines that the client understands the instruction when she says that hyperglycemia may be manifested by which of the following? 1. Dehydration. 2. Pallor. 3. Sweating. 4. Nervousness. The correct answer is 1. Dehydration, polyuria, fatigue, flushed hot skin, dry mouth, and drowsiness are manifestations of hyperglycemia. Hyperglycemia is a medical emergency and requires immediate action to prevent maternal and fetal mortality. Pallor, sweating, and nervousness are early signs of hypoglycemia, not hyperglycemia. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. A 30-year-old multigravida client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, when explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.